So on behalf of Stanford Health Care and Stanford Health Care ValleyCare, I'd like to welcome you to our session today. My name is Rick Shumway, and I'm the president and CEO of Stanford Health Care ValleyCare, located here in Pleasanton, California. Really, we're doing this in an effort to make sure that we're supporting you, our community, to make sure we're hosting a variety of video series to provide you with answers to your questions and help you make informed decisions at this really challenging time that we're all in. Thinking about things like, how do you get the healthcare that you need? What Stanford Health Care ValleyCare is doing to provide a safe environment for you to be in, and to increase your confidence that it really is both smart and safe to get the care that you need without delay. Hopefully you've had a chance to engage with us in some of our previous videos. We've been able to discuss a variety of really great topics, things like hospital safety during the COVID-19 pandemic. We've talked about emergency department preparedness, and again, this really important piece around delayed procedures and surgical care. So those are things that I think are on people's minds these days, and hopefully you've had a chance to engage with us in that way. Today, we're actually going to turn our focus a little bit towards Stanford Health Care ValleyCare and how we are prepared within our community to ensure that you are safe when you come to seek care at our hands. We're going to talk about safety protocols here at Stanford Health Care ValleyCare, things that we've implemented to make sure that you are safe and confident to come to us with any and all of your healthcare needs. In reality, these days, as you think about the healthcare needs that all of our communities have, time is of the essence, and it can make all the difference. So we want to make sure that as you're thinking about those decisions to seek care, that you're comfortable relying on the Stanford Health Care ValleyCare and Stanford Healthcare Network as a whole. So I'm excited today to be able to introduce you to some of my colleagues who are the best in the field, and we're excited that they've joined us this morning. They're going to be here to answer some of your very important questions, really to provide you with this confidence again, to make these good decisions and help you get the care that you need right now. Before I welcome my first guest, let me just talk briefly about Stanford Health Care ValleyCare. Again, here as the president and CEO, it's really been my honor over the last year and a half or so to be part of this organization. I have to tell you that over the past 5 months or so, it has been nothing short of inspirational to watch the teams here at Stanford Health Care ValleyCare that have come together, really thinking of every single possible scenario that could potentially occur with COVID-19, to make sure that we are contingency planning, to make sure that we are putting our hospital and our patients, and most importantly, our community in the very best position it can be, amidst what, again, is a very, very uncertain time. I'm able to walk through our halls every day. I'm able to speak to our staff and our patients and our physicians. And I can tell you that they are ready, that they are willing, that they come every single day, committed to making sure that you are in the very best position possible. So I'm excited about the things that are happening here, again, in what is an otherwise very challenging situation. But hopefully today you'll really get a sense for that as well, as you hear from a couple of people that have really been directly involved with the environment here at Stanford Health Care ValleyCare. So I'm excited to introduce today two of our guest experts. The first is Tracey Lewis-Taylor, who's our Chief Operating Officer here at Stanford Health Care ValleyCare. And we also have Dr. Jack Boyd, who is a Clinical Associate Professor in the Department of Cardiothoracic Surgery in the Stanford School of Medicine. Dr. Boyd has been very involved in our cardiothoracic surgery program here at Stanford Health Care ValleyCare in Pleasanton, and will really be able to share with us some key insights from his view and his perspective. So the first person I want to welcome to the session is Tracey. Welcome, Tracey.
Good morning, Rick.
You want to take just a second and introduce yourself and give a 2-second soundbite around your thoughts on Stanford Health Care ValleyCare at this time?
Yeah, absolutely. Thank you. So as Rick said, I'm Tracey Lewis-Taylor, Chief Operating Officer for Stanford Health Care ValleyCare. I've been with the organization just over 3.5 years now, and it has been, as Rick said, sort of an incredible honor to be part of the organization. But most importantly, it's been incredibly impactful to be part of this organization over the last several months as we have transitioned from caring for our community as part of your normal healthcare provider to being a trusted resource for subject matter expertise and for care during what we all imagine to be an incredibly scary time, both sort of in our personal lives as well as in our healthcare lives. So I appreciate the opportunity to be here this morning and to share with you, as Rick said, a little bit about what we're doing to keep you safe and to keep you protected when you're in the healthcare setting.
Absolutely. I appreciate that, Tracy, and I second those sentiments 100%. You know, it's an interesting time as people are making decisions to seek healthcare, particularly in the hospital environment. One of the things that I think people think about and are concerned about related to this sort of general safety question is how safe is it to come to Stanford Health Care, ValleyCare at this time, whether that's for a procedure or an admission or an emergency room visit or an urgent care visit, those kinds of things. How would you respond to that?
Yeah, it's a great question. I think it's incredibly safe to be here at Stanford Health Care, ValleyCare. You know, I've had the opportunity to round with all of our teams, and I feel very comfortable in the consistent practices that we've put into place across each of our areas, both outpatient as well as inpatient. I want to share a couple key highlights in terms of what we're doing to keep our patients safe. The first I'll start with is testing. That's sort of a big topic that we talk about a lot. You know, I think that Stanford Healthcare in general has been notably leaders in COVID-19 testing since the early days of the pandemic. We've had stable access to supply over the last several months. And in the early days of the pandemic, March and April, we began testing symptomatic staff, providers, as well as patients. As our capacity increased, we expanded our protocols to include testing of asymptomatic staff, providers, and patients, so folks that are not experiencing any symptoms. Back in April, we tested over 1,000 healthcare providers working here on the SHC ValleyCare campus. The number of staff members or providers who have tested positive for COVID-19 is incredibly low. And I'm confident that our infection prevention strategies, which I'll talk a little bit more about, our contact tracing efforts, as well as our early testing algorithms, have prevented those in-hospital transmissions between our staff and our patients. In addition to the direct testing protocols that we have in place, we have a robust occupational employee health team that participate in what we call contact tracing algorithms that ensure that any staff member who has been exposed or who has symptoms is monitored and tested as appropriate. I believe that those practices and those protocols absolutely keep our workforce safe, but then do so in a way that also keeps our patients safe. We have really well-defined return to work protocols to ensure that anyone who has experienced symptoms is evaluated directly by our clinical team before they return back to the work setting. These standards for our healthcare worker screening have been carefully designed to protect both of our staff as well as our patients.
Thanks. That's been so important, I think, particularly as these are the people that are literally on the front line interacting with our patients and our communities. Again, I think that the work that you and our occupational health teams and infection control teams and many others have done has really put us in a unique position to make sure that not only, again, our patients are protected, but also our staff and our physicians. So I really appreciate that. You know, another thing that kind of along those lines in terms of safety that people ask fairly regularly is around how we're doing with PPE, personal protective equipment. That's certainly something that's gotten headlines and taglines over the many months that we've been at this. So could you talk a little bit about how we're doing at ValleyCare with personal protective equipment and how that really contributes to a safe environment?
Yeah, absolutely. We all watch the news and certainly see the challenges that folks are experiencing across the country. Again, I will tell you that as part of Stanford Health Care, we have been able to leverage a very robust supplier network that exists within our system. And through this network, we have maintained an adequate supply of high quality personal protective equipment. So that includes N95 masks, procedure masks, isolation gowns, face shields, just to name a few. It has been truly a day-to-day effort to ensure that we have the supply on hand, but also to ensure that we are using that supply appropriately to prevent the spread of infection between patients and between staff and patients. I think it's also important to talk about some of the other safety protocols in addition to personal protective equipment, but we've done a number of things to protect the environment as well. So in addition to PPE, we have implemented precautions to ensure the safety of our patients within our care. Since the start of the pandemic, we've been restricting visitors within our facilities, as we believe this is a critical step in an effort to minimize avoidable exposures. Because individuals who may have coronavirus may experience mild or no symptoms, the virus may go undetected. And so we believe restricting visitors allows us the most opportunity to protect, again, both our staff as well as our patients. While these restrictions are in place, we do recognize that exceptions may need to be considered in order to support our patients and to support the medical necessity of our patients. So in these particular circumstances, our clinical teams will absolutely follow California Department of Public Health as well as CDC guidelines and guidance from our own internal infection control teams. We recognize that this visitor restriction and these challenges may pose challenges to you as our patients and certainly to your families and your loved ones. We encourage you to speak to your care team to determine how best we can continue to support you and your individual needs and circumstances so that you can return to care in a way that feels personal and allows you to have the support that you need here within the facility.
That's fantastic. Yeah, it's certainly been a dynamic time. Certainly has really required hospitals like ours to think differently about how we interact and how we manage those connection points. And so I appreciate the work that's been done on that. You know, another unique thing that I think individuals in our community would probably be interested to know about is the capacity that we have at Stanford Health Care ValleyCare to take care of any potential surge incidents with the COVID-19 infection. Again, something we see on the news all the time, hospitals running out of capacity and not being able to care for patients. Can you talk a little bit about what's been done here at Stanford Health Care ValleyCare to ensure that we are in the very best possible position to deal with the surge?
Absolutely. So we have a very robust surge plan in place. We've worked closely with Alameda County to ensure that our surge plan matches the county's expectations. But in essence, it's a 4-phased plan that ultimately allows us to increase our capacity over 70% of the day-to-day volumes that we're able to handle. And this includes our ability to expand not only the number of beds that we have located within our facility, but look at alternate care settings, ensure we have the appropriate supplies as well as personnel and resources to take care of that surge. So while we are not overrun with COVID patients today, we certainly have the opportunity to surge, as I mentioned, up to 70% over where we are in terms of our normal volumes.
I think that's such an interesting number, that 70%. You know, the piece that we find interesting is the California Hospital Association has asked all hospitals in California to be able to surge up to 40% beyond their top capacity. And again, to credit to the teams here, we've been able to put into place that 4-phase surge plan that takes us all the way up to 70%. So I think that makes a big difference. You know, the last question I have for you, Tracey, and this is again kind of gets at the heart of who we are and what we hope to make sure and bring to our communities. Can you talk a little bit about the clinical trial activity that's going on here at Stanford Health Care ValleyCare related to COVID-19 treatments?
Sure, absolutely. Well, we actually have several advanced treatment options that are available to fight COVID-19 within our adult hospitalized patient setting. The first, as you mentioned, clinical trials. So we are one of 54 hospitals across the country to participate in the NIH clinical trial Remdesivir. Again, a lot of notoriety in the news, but Remdesivir very early on was proven to have demonstrated success in shortening the time to recovery. So we feel really great about the ability to bring that drug and that treatment therapy to our patients in this population. The second treatment that we have available to us is convalescent plasma therapy, which has also been in the news. Brief description, so it's the liquid part of blood that's collected from patients who previously had COVID-19, contains antibodies that will help fight the infection in patients that are now undergoing treatment. And again, early signs point towards improved recovery for this patient population as well. So what's wonderful about not only Stanford Health Care, ValleyCare, but certainly the inclusion that we have across the Stanford medicine system is that we're able to bring these advanced therapies and advanced treatments to our community in a local care setting.
Absolutely. It strikes me that this is exactly what it means to have Stanford in our community, to really be able to offer those types of therapies even before they're widely available to the general public. So that's been a great effort as well. Thank you, Tracey. We really appreciate you being with us today.
Thanks for having me.
So that is a perfect segue for me to be able to introduce our next guest, our second guest, which is Dr. Jack Boyd. And again, just to reiterate, Dr. Boyd is one of the lead cardiothoracic surgeons in the Department of Cardiothoracic Surgery at the School of Medicine at Stanford. And again, he's been very engaged with us here in Pleasanton in building up and developing our cardiovascular surgery program. And so is very familiar with our environment. And so we're just thrilled to have him with us today. Thanks for joining us, Dr. Boyd.
Thanks, Rick.
So let's actually just pick up sort of where Tracey left off, particularly from a medical standpoint. When you hear and see these sort of news bites around individuals that are really delaying elective procedures or sort of non-urgent, non-emergent care, really out of a fear of being exposed to COVID-19. In your opinion, what are some of the things that our audience really should be thinking about when making a choice as to whether or not to seek care? And as you think about that, even particularly in that cardiovascular space.
Sure. Rick, I think the first thing I have to say is it makes sense to me that people would think the way they're thinking about choosing care based on what you hear in the news. The first month of the pandemic, I have to say I was a little nervous myself coming to work. But with more time and more experience, I've found that the hospital has been extremely safe and that doctors' offices are very safe. The care choices that we want to make should remain similar to what they were before, but we need to walk through the process of why we would make that decision the same way. And I think relying on your leadership, Tracey, having the appropriate processes in place to keep the hospitals and the doctor's office safe will let you know that it's safe to seek care when you would normally seek care.
Great, absolutely, and that's so important. You know, and now sort of drilling down into that next level and thinking about things like cardiovascular procedures, cardiovascular surgeries, they're obviously very major things and sometimes can be very, very scary for patients to go through on their own. You know, as you think about procedures at Stanford Medicine and Stanford Health Care, ValleyCare, things that have been implemented to make sure that our patients feel like they're comforted while they're going through something like this, that again, in a normal world would be really challenging. You know, what do you think about things that have been implemented within our health system to make sure patients feel that support?
Sure. Well, I think they've been very effective in preventing the spread of COVID, and I think they can give comfort to your mind when you make these decisions that would be difficult at any time. So first, all the staff are screened on a daily basis when they come into work. First with a questionnaire, then with temperatures, and then there's even the option to actually have the physical testing. So I think that's very important that we know who would have it if they had very early on. Second, for patients that are coming in and decide to undergo procedures, they too are being tested. So we know ahead of time if someone would have the disease. Fortunately, we haven't seen it in cardiac surgery, but the possibility certainly continues to exist, and we'll keep screening and testing for that. Furthermore, there's ample quantities of hand hygiene solution to wash hands and masks to wear. And it seems that with the appropriate precautions, we can certainly limit the spread of the disease.
Yeah, that's great. Yeah, if you could, as you think about that, the environment and sort of having it be what it is and really be in a position where we can safely take care of patients, back to this idea of delaying medical care, what would you say are some of the risks associated with delaying those care decisions from a medical standpoint?
It's a good question, Rick. I think when things were deemed essential and non-essential and what needed to be limited when we entered the pandemic, heart surgery and heart care was always considered essential. There were never any restrictions on the care of people's hearts. And by its very nature and definition, it is central and essence of life. So it's very important. Now, in the new environment, there are some things to consider and some technological opportunities to take advantage of to help you in this time. Contacting your doctor's office by phone, text communications available, telehealth visits are available. But certainly the signs and symptoms of heart attack and heart failure, worsening of condition, should be dealt with right away. Delaying them can lead to a more critical situation and dire circumstances down the road. So maintenance, prescriptions need to be filled on time at the right time. New onset of significant symptoms, chest pain, shortness of breath, swelling need to be dealt with immediately.
Absolutely. Well, I appreciate that. That's something that I know our physicians and our teams continue to keep a close eye on, and making sure that we're taking care of people when they do come in, whether they've delayed care or not. And, thinking about that a little bit, if you could maybe talk through a little bit about what a patient might expect if they came to the hospital to seek care. Like, what would the process be? Where would they go? How would they be treated kind of along the way, maybe from the emergency room through the operating room and then up into the inpatient floors and ICUs. If you could maybe just give people a glimpse into what that experience is like today within this construct of COVID-19.
Certainly. Well, if you're coming through the emergency department, there is screening and testing at the front door, and people are separated with a suspicion for COVID or a patient under investigation one way, and patients without obvious signs or symptoms of COVID, something that would be more cardiac in nature, a different direction. So we see that there is a separation of patients there in an effort to minimize the spread of infection. The care that you receive would be the same. Your doctors will be wearing more masks and gloves than they typically would, and there's a little more testing. But we still have all the emergency aspects in place in a timely fashion to get you where you need to be at the right time. EKGs, blood work, cath lab, if necessary, into the operating room. Visitation has been limited at times and is changing based on day-to-day circumstances, and special efforts are made to keep communication between patients and their family and care teams and patients and their families, whether it be FaceTime, regular text updates, including families on rounds. So we have seen less foot traffic in the hospital as far as visitors. We currently are seeing visitors, and they are also screened and wearing masks. So the differences exist, but the care is similar to what it was before.
Great. I appreciate that. I suppose my last question really, again, gets at this advice for the community. When people are thinking about making a decision about whether to seek care, what are some of the steps that people should take if they're concerned or feel like they might need medical attention in sort of making that decision?
Yeah, I think the first aspect is to determine the urgency of the care that you need to seek. Emergencies remain emergencies, and the hospital is safe to come through the emergency department if you need to. If you don't need to go through the emergency department, I think it makes sense to call your doctor's office, primary care, or cardiologist and communicate with the team there. One of the side aspects of the COVID pandemic has been a rapid increase in the amount of communications we do with patients via telehealth, via text messaging, and full conversations and visits over the phone. So we've become much more adept at doing that well. And I think at that time, a decision can be made between you and your healthcare provider, whether you should be coming in to the hospital or the doctor's office at that time. And if the decision is made to come in, then the appropriate screening questions can be asked and testing can be done to keep both you and your family members safe when seeking care.
Excellent. I appreciate it, Dr. Boyd. Thanks for joining us today.
Thank you, Rick.
So I'd like to welcome both of our guests back to just really spend just one more minute talking about any final thoughts that both of them might have that would be important for you to hear. It looks like we've got both Tracey and Dr. Boyd back with us. So again, thanks for being with us and for your great comments today. We'll start with Tracey. Any final thoughts that you would share?
Certainly those that are in need of care are experiencing a very real dilemma. And my parting thoughts and sort of my personal perspective is that if you are in need of urgent care or have questions about your health, please don't hesitate to reach out to us, whether it's through the emergency room or through, as Dr. Boyd mentioned, conversations with your physician. That is just absolutely so important. We have safe practices in place, and your health is our #1 priority.
Thank you, Tracey. Dr. Boyd, any last thoughts for us?
Yes, I'd like to reiterate what Tracey has pointed out. COVID health concerns are very real and exist, but there were also health concerns before COVID. And if you're dealing with those, they need to be dealt with the same way as they were before COVID. And the hospital and doctor's offices, specifically Stanford Health Care, ValleyCare, has been set up to keep you safe when you're there. So in dealing with health issues, COVID related or non-COVID related, the non-COVID issues, specifically heart issues, should be dealt with in a very similar fashion to how they were dealt with before COVID.
Great. Well, I really appreciate both of your time. Again, thank you for joining us today. Great perspectives and giving us a lot to think about. So I'm just going to sort of close the session today. First of all, thanking our guest experts, Tracey Lewis-Taylor, the Chief Operating Officer here at Stanford Health Care ValleyCare, and Dr. Jack Boyd, Clinical Associate Professor in the Department of Cardiothoracic Surgery in the Stanford School of Medicine. Really great insights, and hopefully that gave you a little bit of a glimpse into what's happening here in your community to make sure that you are in the very best position that you can be related to a healthcare resource that is ready to take care of you when you need it. We really appreciate you watching today. We hope that you've had, really this sense that the facilities are safe, our staff are in good shape, the procedures are continuing to move forward at all locations. And again, I'll just reiterate sort of the same commentary that we heard a little bit of today. Please take advantage of time. Don't delay care. Come when you need it. We are here for you and we are ready to take care of you. So excited to be able to close the session, but also to invite you to join this same session for upcoming points in this virtual series to give you more insight into what's happening at Stanford Medicine and at Stanford Health Care. So thank you again, and be safe out there. Thanks.